pressure was higher than expected. My cholesterol was higher than expected. My blood sugar was higher than expected. And people look at me and think, hey, here's this guy with this small frame. But you really are the product of what you put in. And, you know, the fact that I've gotten all of that corrected, simply with just making some lifestyle changes, even seeing a therapist myself, because you can't separate mental health from the other aspects of health. I know that we can do better.
What resources are available for people who, you know, want to get active, want to get screenings, need to get their primary care physician, anything dealing with mental or physical health? What resources are available here in Mississippi?
Listen, there are resources statewide. Unfortunately, sometimes a lot of patients don't know that, and this is why their primary care clinician is so important, because some of the resources that may be available in North Mississippi may not be available in the Delta. So really establish that relationship with your primary care clinician. You can get free tobacco help across the state. We have several centers that help with that. There's diabetes self-management classes to help patients get control of diabetes, same for prediabetes. The health department has a presence in just about every county and has a lot of these services. UMC, we have several services where patients can come and directly be seen. We have several where we're doing telehealth. So it just depends on the need. Mississippi is at the bottom of healthcare, not because we want to be, it's because we choose to be. But if we take the time and educate ourselves and we invest in the resources that we need to, we can get off the bottom, and we will get off the bottom.
Awesome. Anything else that I did not ask that you want to say about Men's Health Awareness Month and the importance of early detection?
Yeah, so from a screening standpoint, men, I mentioned lung cancer. So now we have approval for screening for low-dose CT for lung cancer. This is something newer. A lot of people may not know about it. But men at age 50 to 80, if you have risks, basically if you have smoked in the past or if you currently smoke, you likely will qualify for a free low-dose CT scan. So get with your clinician and get that test done, and that can be done once a year. That test has already caught lung cancer early. Prostate cancer, that's the most common cause of cancer in men. That's a simple blood work, PSA test. A lot of men don't want to go get that done because they think they have to have a finger test, but the blood work is very sensitive and specific with being able to catch prostate cancer. So men, go and get that blood work done and get your PSA level checked. So men who come and get their PSA level check and they have elevation, which suggests prostate cancer, the 5-year survival is greater than 99%. Now that prostate cancer extends beyond stage 1 into later stages, sometimes that drops down to 33%. Wow. At 5 years, so totally preventable. So that's lung cancer, prostate cancer, colon cancer. Colon cancer, we still have men who are not getting their colonoscopies at the appropriate age and time, which can prevent colon cancer. So it used to be age 50. We have lowered the age down to 45 to get screened for colon cancer, a simple colonoscopy test. And if you say, hey, look, doc, for that reason I don't want to get that done, we now have stool tests such as Cologuard that you can get done at 45, where a stool kit is sent to your home. You basically put some of your stool in and send it back, and if that test comes back normal, there's a high chance that you don't have any cancer. So the point I'm making is, where there's a will, there's a way. Control your controls. The things that we can get done, let's take advantage of those.
Right. And what are the benefits of early detection, of people actually taking effort and getting these tests and going to the doctor and being active, opposed to not doing it?
Well, first of all, I would like to say that a healthy Mississippi is a fruitful Mississippi. A healthy man is a strong man. A strong man leads to a strong family. Men are the catalyst. So it's time for men to take their rightful places and make sure that their health is together, because there's a lot of men who worked very, very hard, built a lot of wealth, and died at 45 because they weren't taking care of their health. So as it relates to where we go from here, I think it's important for men to understand that health it's not just physical health, but it's mental health, it's financial health, it's spiritual health, social health. All of that plays a factor in their livelihood.